Health workers are at the fore of the battle against the coronavirus pandemic. Some have even been infected in the line of duty. The United States of America is one of the countries that has been affected and is still being affected significantly by the COVID-19 pandemic. Coronavirus-related deaths in the country is fast approaching 200,000. Joining me via Skype to discuss this is Dr. Grace Ogiehor-Enoma, the Executive Director, National Association of Nigerian Nurses in North America. Thank you for joining us on TVC Midday News.
Thank you so much for having me, and good morning from New York, Big Apple, and good afternoon, Nigeria.
All right, it's good to have you on the program, the news this afternoon. Let's first of all understand how challenging it has been. There are reports talking about nurses being depressed because of the long hours of work, the challenges they are faced with, talking about not having enough PPEs. How has this impacted your work and the fears that a lot of you, as members of your association, has faced in trying to fight this pandemic?
Right. Thank you for bringing that up. During the surge, which was March and April in New York, and we were recording high number of deaths in the patients. And one thing I want to talk about now is lesson learned from it. That's why the nurses were anxious, were scared, but the uniqueness or the unique function of nursing actually came out at that time, where nurses who were at the bedside, became a bedside scientist. Because at that time, as the patients were dying, nurses' assessment skill, were not put to test. At the beginning, where we did not know what we were doing by intubating patients, we find out what we call happy hypoxia, where the nurses could be talking to a patient where you think the patient is comfortable, and then the patient dies. So the nurses actually put, their thinking skills up, using the assessment to find out what was happening to this patient, analyzing situations. And that was when they now quickly realized that most of these patients didn't need to be on ventilating machine. We could use proning positions. Positioning these patients, using prone position is, before COVID, we usually use our prone bed to prone the patient. At this time, we didn't have enough prone bed, but these patients, these nurses, put in their thinking skills and started repositioning the patient. And that brings me to this area of focus that today being World Patient Safety Day, we need to look at the lesson that we've learned, from pandemic. At that time where the nurses, what they did was not only to prone the patients, but also looking at the patients, monitoring their pulse oximeter, ensuring that the patients were using their incentive spirometer, helping the patient to ambulate. Guess what? That brings the unique function of nurses. And that is why now I am advocating that we need to invest in nursing so that the patient can be safe. Because of those assessment skills that those nurses brought into play during COVID-19, in New York, we're able to reduce deaths. We're able to reduce patients from going to the ICU. So as we speak or talk about World Patient Safety Day, we need to look at the role that nurses are playing at the bedside. You may have the best hospital with the best building, the best doctors, but if the nurses are not competent, the nurses at the bedside are not competent, we're going to have poor outcomes. And this pandemic has actually brought this uniqueness up. And I want us to focus on that as we speak about patient safety today being the World Patient Safety Day.
Now, you talked about investing in nurses. What are you looking at when you're talking about investment in nurses?
Nurses' competency has to be part, education of nurses. We need to bring, especially in Nigeria, because I know we're doing that now in New York, in the US, where nurses have to have their masters in nursing. You have to have your master's degree. You have to focus in research. We call nurses as bedside scientists. When nurses are at the bedside of the patient, they should have that assessment skills that tells, is the patient doing well? Is the medication working? Remember now, it's the nurse that is there to assess. You could have the best doctor. If you don't have a competent nurse, that patient is not going to have good outcome. Now that we have high maternal death in Nigeria, I also feel that nursing in the community, we have to invest in nurses in the community so they'll be able to bring that assessment skills, assessment tools that they know. We need to educate nurses at a higher level of education. It's not enough to educate the patient at the School of Nursing. We have to advance these degrees. And now in the US, we're having a lot of these nurses doing their doctorate in nursing practice, clinical competency, so that science, we are using science to drive care. If science is not...
And before we let you go, because we have some limited time, you talked about the intervention that nurses brought to the fore while addressing the needs of patients. How has that affected the numbers with regards to COVID-19? And what is the level of response to the safety protocols?
Right. And right now, with that safety procedures that the nurses brought to the bedside, it actually decreased, the number of deaths and the number of patients in the ICU. Right now, I work in a facility that is about 525 beds. At the surge of COVID, we were 100% COVID, all our patients. We opened more ICU beds, but guess what? We've decreased. We now have only one patient in ICU, and thank God to the nurses, and I give it out. Also, mitigating the spread, I give it up to my governor, Governor Cuomo, who has also helped using science, leadership, using science to address protocols. Schools are reopening now, and restaurants are reopening also because we're using science. And once your community infection rate is more than 1%, it's going to shut it down. So it's using science to drive care, to drive policy, to drive leadership, and that is even what nurses have to use science in providing care to patients.
All right. Dr. Grace Ogiehor-Enoma, the Executive Director, National Association of Nigerian Nurses in North America, thank you for your time on the Midday News.
Thank you so much.